Long-term success and survival of endodontic microsurgery by Huang et al., a group from University of Singapore, published in JOE in 2020. So published long-term healing rates after endodontic microsurgery has been inconsistent in terms of accounting for uncertain healing and extracted teeth due to reasons related or non-related to endodontics. However, the healing rate was found to range from 84 to 93% according to Von Arx 2014. And more importantly, recent meta-analyses like the work of Torobinjad 2015 suggest that there is a tendency for healed rates to decrease in the long term of more than 4 years. So the aim of this study was to evaluate the 5 to 9 years healed and survival rates of endodontic microsurgery. 2, to identify association between prognostic factors and healing status. And 3, to compare the short-term 1 to 2 years with long-term 5 to 9 year outcome. For the material methods, this is a retrospective study on patients' records or on patients treated in the National Dental Center of Singapore, the University of Singapore. Surgeries were performed by endodontic practitioners, either endodontists or residents supervised. After collecting the patient data from the files, patients were contacted to participate in the study, and all eligible patients were recruited. The examination involved radiographs utilizing periapical digital radiographs and a clinical assessment. And all assessment has been done by 2 examiners who were calibrated. For the treatment outcome, a tooth was deemed healed if it was clinically asymptomatic and had a radiographic classification of complete or scar tissue healing. So they ended up with 86 teeth eligible for assessment, and the 92 teeth total, the remaining 6 were extracted teeth but included in the multivariate analysis for prognostic factors. For the results in brief, of the 191 teeth in the cohort, 32 teeth were extracted for the following reasons: 6 for endodontic failure, 7 for vertical root fracture, 5 for unrestorable crown fracture, 3 for caries, 2 for periodontal disease, 1 for horizontal root fracture, 1 for prosthodontic treatment plan, 1 for cemental tear, and 6 for unknown reason. After excluding 7 teeth that were extracted for unrelated reasons, 1 tooth that presented with vertical root fracture, and including 6 teeth that were extracted because of the endodontic failure, the data in relation to 92 teeth were used to compute the healed rate of 72 out of 92 teeth, which accounted for 78.3%. And for the prognostic factors, the 9-year survival rate was 95.2, with average time to extraction of 111 months. For the prognostic factors, 3 prognostic factors were found to be potentially relevant in the univariate analysis: mandibular anterior tooth type, known history of non-surgical retreatment, and the type of radicular root end filling material. In this article, they compared IRM to MTA, and they found MTA to be more associated with the healed outcome. So for conclusion, endodontic microsurgery results in high long-term 5 to 9 years healed rate and survival rates, and the type of root end filling material and non-surgical retreatment before endodontic microsurgery influence the long-term outcome. Teeth deemed healed in the short term appear to remain so at the long term, and teeth deemed as uncertain healing in the short term should continue to be reviewed.